The crisis intervention program really started out of a community-wide effort to streamline crisis response services.
We're hoping that it'll allow for a third-tier response resource that would actually get the right people responding to this. Emergencies, whether they're law enforcement or fire EMS, are continuing to rise every year. And our resources are stretched thin. So being able to add in a subject matter expert that is able to deal with these and take some of that burden off not only our 911 system, but our emergency response system is crucial to be able to keep up with the demand in our community.
Patient now all of a sudden gets put with a person that knows all the resources, knows what things are available to that person in Great Falls, Montana, and can follow up and do that, where law enforcement often cannot.
What this allows us with this new crisis intervention program is to really focus on that jail diversion. Jail is not a positive place for those with mental illness. It oftentimes increases symptoms. And so if we can be able to be called before and evaluate and divert from that jail setting and refer to services where they're seen in a medical or behavioral health setting, then oftentimes we're able to diffuse those symptoms rather than increase them in that jail type setting.
We had a person with severe mental illness, and he was putting things in social media about killing law enforcement. He was barricading himself into a house. He was basically threatening to harm any police. He showed us pictures of a gun. He showed us pictures of ammunition. So we found out where he was at. Our tactical team was called out. We wound up conducting an operation on that, and we had phone contact with him. He wanted to basically see his therapist. And I was not in a position where I was going to put his therapist in harm's way. But from a block away, we basically told him, if you step out unarmed and look down the street, you'll see your therapist standing next to me. And she was standing right next to me, kind of behind me, with so that there was somebody wearing body armor in between her. He came out, saw her, because of the relationship that he had established, immediately surrendered. So that, to me, was a light bulb moment that goes, we need to have the folks that are involved in these relationships with folks with mental health needs available, coming to particular calls that can help us know exactly which direction we're going to take with some of these things. Because that could have been a horrible day for us. And it turned out being a fantastic day that we got this person the help that they need.
We function as a team, and in order for me as a mobile response team clinician to do my job, I need them. And I think they also would agree that in order to divert and redirect, that it takes all of us to do the best job we can for the community.